It's being
Yeah,
recorded.
then Louisa could listen in.
Good.
Yeah.
Yeah.
And then that way, also too, if you need multiple presentations in order to make your decisions, then we can do another live presentation. That's fine. But
Mhm.
where in the process are you with reaccreditation? I saw you guys were accredited in 2016,
Mhm.
and are you going through that process again?
Yeah, so we just wrapped up on Monday. We just wrapped up our resubmissions for our documentation. So we had submitted all of our documents last September, and then this April we received, their reply. We have replied to all of their, concerns, questions, requests, and just resubmitted those things on Monday. So, yeah, so we're now kind of in that waiting game of, finding out, did what we resubmit answer their questions? Will they have more questions? And then ultimately there will be a site visit. And so we will be waiting, until we hear more at this
Okay.
point.
And then
But yeah, go ahead.
I was going to ask you, what are you guys using for performance management now?
Yeah, so this is an area that a number of years ago we had identified as a quality improvement council. We identified performance management like a system as a gap. And pre-pandemic, then we had received a presentation from VMSG. We had received a presentation from, I think, Clear Impact and also ClearPoint Strategy.
Mhm.
And we had wanted to pilot the VMSG dashboard, and that was set up to pilot in March of 2020, which is when the whole
Bad
world
timing
then
that.
shut down.
Yeah.
So consequently, we really never, I mean, as a public health department, we never really even picked this back up until probably the last year, where we were like, okay, well, we still don't have, like a health department, um, performance management system. We have a citywide system. It's even hard to call it a system. We have an office within the city enterprise that is called, and I'm going to get the name wrong, something like performance management improvement or something. Anyway, it's got some acronym, PMI.
Yeah.
And um, they also, during this same time period, over this 6-year period, went through like different iterations of what they were going to do, had staff turnover, and, and are now, themselves kind of getting reestablished. But my understanding, and Cindy can share more about this, is that they really work at kind of that whole enterprise level. So the information that we provide them from the health department may be a very tiny selection of measures that can kind of feed up to citywide goals.
Right.
Yeah.
And so it's not really, I mean, if we're being really honest and truthful, it's not really a system that would gauge our effectiveness and really provide us with that detailed information about where can we make improvements, because they're really looking at such a tiny little slice of the metrics that the health department provides them. Cindy, would you say that that is true? And I'll mute. I've got
Yeah,
noise going on behind me.
I would definitely say that's true. Like for my program, there are only like 4 or 5 things that we report out. And I have the food, lodging, pools, tattoo, kind of traditional environmental health. And uh, sometimes it's more like bean counting than it is, they're interested in how many of this and how many of that, and not necessarily impact or prevention.
Yeah.
Or we try and keep track of like educational opportunities and connections and things like that. But I'm not sure they're necessarily asking the right questions.
And sometimes I think that what we do here at Public Health, doesn't require, accounting. It requires project management. There's so many projects, and we'll show you here in a minute. The type of activities that you do might be wrapped around a project, and it may not be how many widgets we installed or immunizations or so on and so forth. And that's where it's difficult for people to gauge, how am I doing on this project? And we'll show you here in a minute. I vaguely remember, I think that Ellen a gal named Ellen used to work for me, and she was the one that was starting to set up that evaluation. And it's funny because even though 4 years ago is when all that started, it's like a tsunami. I have found that
for sure.
we had and we have 240 health departments, and probably a good 70% of turnover. So a lot of history was lost. People who had been there for a long time had retired. And then we thought, okay, what we're going to do is we're going to retrain everybody. By the time we got through retraining new people, there was another turnover. And so now I feel as though with all the grants and so on and so forth, it's kind of stabilizing. With performance management, what we decided to turn our focus on was workforce development as well. So providing a system and training that will also develop that workforce for all that lost history of knowledge that, through the pandemic happened. And if I may, unless you have questions, I might start it. And you've seen this before, but yet there's been so many changes. Hopefully this will all look brand new to you. The first thing I want to tell you, and this has not changed, is the first thing that you are going to feel is that you're getting a drink from a fire hose. We added the visual to tell you that, okay, there's going to be a lot of information coming at you. And we know that, but at the same time, if you guys decide to utilize us, we chunk this down further in the training. But we want to show you everything the dashboard does, because after FAB accreditation, life goes on, and reaccreditation, life goes on. Pandemics happen. So hopefully you'll see all the improvements here. When departments usually come to us, or I'm making those pesky phone calls, they're kind of feeling a little chaotic, that there's so many different systems. They've got grant tracking. They have their strategic plan. They're doing FAB reaccreditation, SOPs. This is our chaos horse. And we hope that by the end of the presentation, you might feel like, okay, this is a little bit more chill. Everything is in one place. I can see how we could use this. Mission accomplished. And by the way, we're just very, very lucky that my daughter, who is our illustrator, graduated with an art degree. I like to make things fun because sometimes systems can be very, very boring. And you can tell. Oh, well, I'm sorry. It's my right brain, your left brain. When we were built a number of years ago, it was in a public health department, and we never left. The director wanted to have an operational planning and execution system. And Fred is the developer, and he kind of lived at this department here in Arizona, where it's going to be 118. And he also wanted the performance improvement or quality improvement piece structured into the system, that plan, do, check, and adjust cycle. And lo and behold, FAB came along in 2011, and they had a fully demonstrated performance management system, which was the VMSG dashboard. And we decided to take it out to market to all public health departments nationwide. And show them how they could use this for FAB accreditation. One of the key things for us is that we were able to meet that standard 9.1, measure 9.1.1a, and that is we can reach all levels of your department. And of course, my mind started going as you were talking about the city, including external partners to be engaged in your organizational success. We needed to define what performance management was specifically. Go ahead.
Andrea, I'm sorry, could you just go back to
Yeah.
that previous slide? Yeah, just for 1 second. Sorry. I was just kind of reading the information that was on that.
Oh, well, yeah. And if you're going to be going through a site review, that might be something, with the 9.1.16. Was that what you were looking at?
Yeah, I was kind of looking down further on the slide. Okay, thank you.
Okay, you betcha.
Well, just kind of an FYI, 9.1.6 basically says you have to have people at all levels engaged in performance management. We automate that process through what we call real-time planning, where everybody who's involved in any plan gets an automated email and the ability to go back into the system and do the updates. So it kind of automatically meets 9.1.6 for you.
So, that part engages the staff, in doing that. If you can imagine, there might be a department lead that has to gather all the information of how everything's going, and they're making phone call after phone call, or the accreditation coordinator trying to get that information. Here, those people are accountable that are doing the activities, and they go and they update their activities. We make it easy for them also through our mobile device, which you're going to see this in just a moment. And then they report to the objective lead or the team lead on how they're doing on that specific project. So with performance management, with VMSG and in public health, it's 3 basic steps. And that first step is creating a good operational plan. We can make plans all day long and we can put it in a binder, but to make them operational, we really focus on getting those people involved. But that's just a specific group of people. This plan is a specific group of people doing a specific activity in a specific time frame with a specific measure. Okay, so now we've got the plan in place. Now we're going to execute the plan and we're going to monitor it. We're going to monitor it on many different levels. The first level is going to be the macro level. So if you have maybe community health director wants to possibly look at a project, they can look over that whole project to see how they're doing, or look over their whole department to see how they're doing. Every office and division and program can have their dashboard. Then the next level would be the micro level. This means that if anything's going to go awry in your plans, it's going to be here. Like Fred's going to retire, or somebody's on a maternity leave. We don't have enough widgets to install. And this is a way that the people that are doing the activity has the ability to communicate that to whoever that activity lead is, or the objective lead, and say, hey, this is why our traffic lights are here at yellow. We've slowed down. Okay, then we have the public view. So it seems as though this became popular about 6-7 years ago, where they put a public interface or something on their website saying, hey, this is how we're doing on these projects. And it may not be a real detailed level, but they want to know, hey, we're in the green, our strategic plan's going well. This is also used many times in our departments to report to the Board of Commissions or to the director, because he just wants the plain facts. The very last step to performance management in the dashboard is that performance improvement. So we built the plan, we're executing the plan, we're checking it through all the different levels of monitoring, we're making our adjustments in the plan and going back into the plan. And with a strategic plan, you guys probably have witnessed this, it just kind of goes around and around in circles. You're constantly updating, you're constantly making improvements to it. Okay, then when Fred opens up the dashboard, if this will seem familiar to you, you're going to see some navigational tabs going from left to right. And the pyramid is to help you visualize what the hierarchy is of those tabs. So the first tab you're going to see is your department or your organization. The next tab that you're going to be utilizing would be the groups. Now, those groups can be anything from a strategic plan to workforce development to community health, FAB accreditation. Underneath each group, they're going to have their own set of services and initiatives, what they're planning on doing in the future. Underneath those services and initiatives, they're going to have their own set of goals, those goals, objectives, those objectives, activities. And this is where Fred thinks that breathing is overrated and it goes by really fast. But you know, I kind of forced him into putting in some screens that say, do you have any questions? Meanwhile, when he gets on, I'm going to go turn off my camera and reload the meeting. So maybe I could be lucky on this. You ready, Fred? Yeah. Okay.
Okay.
It's weird sitting next to you like old times. Okay.
Thank you, Andrea. So what we're going to do now is we're going to go live into the system, and we're actually going to kind of walk through those 3 phases Andrew described. We're going to build a quick little operational plan. And again, you may have seen this 4 or 5 years ago. We're going to use the example of tobacco cessation. Then we're going to take that plan through its life cycle so we can see the various tools that we'll use to monitor it. And then we're going to walk it through that PDCA cycle to see how we might keep all the plans up to date in there. So let's go live into our system here. We have this little demo organization we call USA Public Health. And when you log in, you'll see a screen similar to this. But these are the tabs Andrew was talking about across the top. So if I flip that pyramid on its left side, here they are. The organization is your health department. Groups is basically the structure of your health department, plus what we call the primary plans, what FAB calls the 6-pack of plans. You guys are very familiar with those. Those are typically individual groups. Each group then has its own set of services or initiatives, goals, then objectives and activities. So let's go to our groups tab here. You'll notice I'm on a community health division group. So everybody has a default group when they log in. So if I'm the community health director, obviously that's where I'm going to go, which helps you to avoid navigating around. I can go right to my dashboard for community health with just one button click. For today, I'm going to go down to this group called Tobacco 2024. And I'm going to navigate down the pyramid. So I'm going to the services and initiatives specifically for Tobacco 2024. And here you see tobacco cessation is one. That's one we'll focus on today. Secondhand smoke, tobacco initiation and prevention. The only real difference between a service and initiative is that an initiative is a future project. So we're going to consider tobacco cessation as something we're attempting to roll out in the future here. Under the initiative of tobacco cessation, we're going to have a set of high-level goals. The high-level goals are exactly that. It's a kind of a quick definition of what we're trying to accomplish without the detail. And at this point in time, you'll notice we set the traffic light out there. The traffic light is a pretty common visual indication of the status. And you'll notice there's actually 4 different traffic lights here. Green is, as you'd expect, is go. Everything's moving along as expected. Yellow would be something is potentially slowing us down. Red would be something brought us to a screeching halt. And then the gold bar would indicate successful completion of that portion of the plan. Now, underneath the reduce smoking in high schools, we're going to get down to the detail. And that is what we call the SMART objectives. Now, if you Google SMART objectives, you're going to get lots of definitions. I'll just give you ours. We use the term specific, measurable, attainable, relevant, or realistic, take your choice, and time-based. Now, if it's not attainable or if it's not realistic, why go after it? So we kind of focus on specific, measurable, and time-based. So here's an example. We're going to reduce smoking at my old alma mater in lovely Dayton, Ohio, Wayne High School, by 25% by the end of the school year. So this is our target. Now, to get there, we're going to assign this person called an objective lead. Steve is our objective lead. He's got 2 jobs. Number 1, he's going to get us to this target. So he's the project manager, program manager. And number 2, he's going to keep the status up to date here. And the way he's going to do that typically is through that real-time planning interface. Real simple. It's an automated email that will go out to Steve on a regular basis, typically monthly. That email is going to have a link in it to take Steve right back into this particular objective to be able to do the update in here. Now, as Steve is making updates to the traffic light or the values or anything, he's typically going to put a note over here as to what he did. And you'll notice it's got this little button right here, which is a date and timestamp. So it says that on 3/25/24 at 8:38:32 a.m., Fred Erickson put this note in here. It's going to continue to stack the notes in there as you get them. So anybody can go back and look at the history and see exactly what happened and why and who did what. The other thing we've added since you guys seen it last time and kind of over a COVID thing was the ability to add data sources. So where am I going to go to get this current status of the reduction? Well, let's say that we can get that from the CDC Smoking Cessation Fast Facts website. So I have the ability to put that data source in here. Here's the link. If I click on that, opens up a new browser tab, and sure enough, it takes us right to that particular website. So if you have a place that you can get the data to update the status of your plan, why not have it at your fingertips here? Now, in order to get to the objective, we're going to have a set of, people call them action steps, we call them activities. And it's just the steps we're going to go through that we believe will get us to our target. In the dashboard, there are 3 distinct types of activities: project-based, quality assurance, quantitative measurement. Got an example of each of them. We'll kind of go through them at a high level here. But our first one is a project-based activity. So think of anything that's a project, basically. So create training content materials for students and faculty on the dangers of smoking. Think about PowerPoints. Maybe if we got video capability, we could do that. User guides, everything we'll need to go to the schools and do the training. Every activity's got a performance metric. How do I know when I've successfully completed the activity? You're just going to define it there. You're going to put a beginning and ending date. So this is when we're planning on doing it. And again, the notes are going to track us as we're going through it. So you notice up here, Diane Cox put this note in here that says, down here, completed chapter 1 back in 1/19 of 24. This is our measurement here, 100%. At this particular time, back in chapter 1, it was probably, 25%, one of the 4 chapters. And then we got to chapter 2, 50%, 75, 100%. So it's a real simple measure, percent complete as we go through. Now, when we go through the training, there's a lot of different options on each of these activities we'll talk about. But for now, we'll just kind of go over the overview. The other thing we're going to do is tie a team of people to that activity here. So by clicking on this pencil icon and then opening it up to the whole department, you can see I have a team column over here. So these are the 3 team members who are creating the training content. The team lead, in this case, Diane Cox is our team lead. So she's guiding the team. And then that email notification again. So in addition to Steve getting an email, Diane's going to get an email that links her right back into this activity to just determine how far along she is in creating the training content. Over here on the right, FTE, full-time equivalent. During budgeting seasons, or if you're looking for grant dollars, it's nice to know how much is this program going to cost us going forward here. So if you go through and you estimate the amount of each person's time, 0 to 1, basically. So in this case, 10% of Diane's time and 10% of William's time and 30% of Andrea's time is going to go into this. If you take that number, you can roll it all the way up the pyramid. So at the activity level, it rolls up to a 0.5 FTE. Take these 3 activities and roll them up to their objective. It's a 1.0 FTE. So at any level in the pyramid, you can get an idea of what is the cost. So you take that 1.0 and multiply it by your burden labor rate per employee, and you get a good idea of what that costs. Again, typically only used during budgeting cycles, or if you're going after grant dollars to kind of quantify the need there. In addition to internal folks, you can add external partners. So let's say we're working with, in this case, VMSG Dashboard, and specifically Fred Erickson at VMSG Dashboard on doing, let's say, video content. So Fred is helping us to do video content, so we're going to link him into this. Now we can also make Fred the email recipient. So if he's just doing the activity by himself, instead of us having to play phone tag and contact Fred, Fred can get the email. We'll train him on how to do it. It's a very simple process to go back in and update the current status of his particular activity in there. So that is our first activity, the project-based activity. Our second one then is we're going to take that training content we just created, and we're going to provide 9 training sessions each month on the dangers of smoking to students and faculty. This one we call a quality assurance activity. Unique in a couple things. First of all, it's cyclical. So we set a frequency, which can be anywhere between weekly and every 5 years. In this case, we're measuring it on a monthly basis. The other thing we're going to do is put some values in here that says, let's set the traffic light automatically based on our inputs here. So if we make it to our 9 training sessions a month, it's going to be green. If we only get to 6, we decided is not good enough, so that's going to be red. And then 7 or 8 will be yellow. So again, cyclical. You're going to have a beginning date for the cycle. In this case, we're saying it's 4/15, meaning that the ending date would probably be around 5/14, something along that line. And we're going to move forward each time and measure within that monthly cycle. And again, you got the activity leads, team members, and external partners out here. Our third activity then is what we call a quantitative measurement activity. We're going to contact all 20 tobacco vendors within a mile of Wayne High School to assure they're not selling to minors. Very similar to the project-based activity I just showed you, with the exception that we can now track quantities. So how many vaccinations did we do? How many car seats did we distribute? How many tobacco vendors are we going to contact? So it just gives you a little bit more data to calculate your percent done versus having to go in and say, well, let's see, we did 20 out of 20, so that's 100%. Well, it'll take care of that for you. So those are the 3 activities that we believe are going to get us to our target of that 25% reduction at Wayne High School here. Now, if I go back to the pyramid, it looks like this. Our organization was USA Public Health. The group we selected was Tobacco 2024. One of the initiatives was tobacco cessation. Under that, one of the goals was to reduce smoking in high schools. Under that, one of the SMART objectives was to reduce smoking at Wayne High School by 25% by the end of the school year. And then the steps we're going to go through to get there. So this is the planning model. Every plan falls into exactly the same model. Sometimes you'll see variations in the nomenclature, and we'll go through that in our operational planning training. But basically, the model stays the same. So now we've got our plan in place. Let's walk it through the PDCA cycle. So boom, we have the plan. Next thing we're going to do, obviously, is execute the plan. So in order to execute the plan, we've got Diane guiding the team to do the training content. When she gets done with that, then William's going to take that training content, go out to the schools and provide those 9 training sessions each month. And in parallel with that, Tom is going to go out and contact those tobacco vendors. That's where the real-time planning comes in. Each of those folks is going to be designated as an activity lead. They're going to get that email, again, typically monthly. They're going to get that email. They're going to be able to take that information, go back in and update the status of their activities and their objectives in the system. And the reason that's critical is because the check phase is pretty simple if you do that. The check phase is comparing the plan to the actual. Well, the actual is what we're collecting here in the background. And it might look like this. So this is our reduce smoking at Wayne High School objective. If I click on this little chart button right here, it shows me from day one how we've done. Started out at a 0% reduction, obviously in a new program. Worked our way up, and got up to our 25% target. So we had a target of 25. We have an actual of 25. That tells me everything's working beautifully. Now, that's the check phase if you're collecting all that information in the background. We also recommend highly that that information comes from the people who are actually doing the activities. Some people will go in and say, okay, I'm gonna let the supervisor do that. Well, what you're doing then is burdening of the supervisor with playing phone tag with the person who's actually doing the activity, collecting the information, go back and put it in the system. It's a waste of time. The system will take care of all that for you. So now we're in the check phase here. We determined that our plan was 25, our actual is 25, everything's beautiful. Then we go into the adjust phase. In this particular case, there's no adjustment necessary. It's working great. We're going to bypass the plan change, continue with the execution, check it every once in a while, and go through this cycle. Let's assume for a second that the top of that chart I just showed you, which by the way is what we call micro level performance monitoring, down at the objective and activity level, was sitting at 21%, not 25%. Now we've got to make a decision. The decision kind of comes down to one of two things. Is the plan too high? Can we just not get there? Is 25% not realistic? Maybe if that's so, we adjust our plan down to 21%, continue to execute, continue to check, go through this cycle. The other option we might choose is, no, we can get there. We just need more resources. So maybe in this case, we say, hey, maybe we need to go to 12 training sessions a month versus having the 9. Maybe there's more tobacco vendors out there we didn't know about. Maybe there's a whole nother set of activities we hadn't contemplated yet. So let's adjust those resources to get that 25%. And then there is kind of a fourth option, and it's kind of in between. Let's say maybe the plan is just a little bit too high. So maybe 23 is a more realistic number. And maybe if we go to 12 training sessions a month, we can get to 23. So this is the PDCA cycle that keeps all the plans up to date. Now, as you guys are well aware, every plan in the fab world has got a life cycle. So these 3 guys over here on the left have a 5-year life cycle, your CHIP, your CHA, and your strategic plan. Well, think about this. In effect, through the real-time planning, that 9.1.6, you are in fact updating your strategic plan, the beginning date of it, on a monthly basis. So realistically, your strategic plan kind of has an infinite life cycle because it's always moving forward with the real-time information in there. So really does kind of help you in a lot of those areas in accreditation. Now, again, the micro level chart is at the bottom of the pyramid, the objectives and activities. So the detail level of what's going on. We also, what we have, we call it macro level performance monitoring, which is the dashboard itself. Let's go back and take a look at that. So the dashboard is dependent on the group selected. As I mentioned, when I log in, I'm the community health director today. When I log in, it puts me to community health. The only thing that I need to be able to do to get to my dashboard for community health and the 2 groups here, tobacco and WIC, reporting to community health, is to click on this button up here at the top, the traffic light. What it's doing now is going into the background and putting together literally hundreds or thousands of data points that are related to community health and the existing programs under community health. And it's going to give us this dashboard. Now, the first thing I like to show people is this homepage button up here. What that means is I can make this screen my login homepage. So instead of going to the menu and then navigating to here, when I log in, I can go right to here. So if I'm the health director or the community health director in my case, and the only thing I really want to see is my dashboard. I don't want to be updating information and looking at it and things like that. I just want to see the dashboard. So I can set this homepage button. Next time I log in, it takes me right here. The main menu is the default, this guy up here, and the reports menu is another option in here. So you can set it to one of 3 different places. What I'm looking at up here is kind of the number of traffic lights in each status at the activity or the objective or the goal level, the bottom of the pyramid. Now, everything here is clickable, so I can roll over these and I can look at these 3 activities, find out exactly what's going on, maybe get them back on track. The other thing we have here is kind of a nice little thing. It says, currently, for all of these 10 activities that we're monitoring, we are 7 days ahead of schedule, hence the reason it's green. Once you get below schedule, it turns yellow. 60 days below schedule, it turns red. So by looking at the numbers and the colors, I can say everything looks pretty darn good here. Ideally, you want everything to be green and gold, meaning they're completed or on track. And you want to be in the green on your schedule, meaning you're kind of ahead of or right on schedule here. Now, if I want to drill down further, I can go down to the bottom, and I got 3 different views down here. First of all is my people. So these are the folks that I assigned as activity leads. This is the last time they updated it. Ideally, you want everybody to be green, meaning less than 30 days ago. Yellow would be 30 to 60, and red is over 60 days. So, it might be worth having a conversation with Tom as to, why he's not been able to get in there and do the updates. Here's that FTE value rolled up by person. So that same value we're talking about, for budgeting and that sort of thing, just to make sure that we're not overloading people in the FTE values here. Lagging says I have an activity that is calculated to be behind schedule. So beginning date, ending date, percent complete, pretty simple calculation. The days column here says that Diane is overall across all of her activities, 73 days ahead of schedule. Great. Overdue says she has 2 activities that the ending date of the activity was before today, and it's not 100% complete. And then the number of red, yellow, green, and gold for Diane. So you got to look at each person's performance going down here. The other 2 views I have are my groups. So in this case, it would be the group names down here, same basic information over here, and priorities. Priorities is the ability to look at the strategic plan. So the strategic priorities from your strategic plan appear down here. And how do they map against everything else in the system? So you've got another, 5 fab 6-pack of plans to map your strategic plan against. You got your community health plan, your emergency operations plan, everything that you put in the system, you can map against your strategic plan. That allows you to understand how well is our strategic plan working. And in fact, how well does everything else map to our strategic plan? So it's really kind of a cool view. Top right corner up here, my priorities. These are basically bookmarks. You pick the objectives that you want to watch. Again, the objectives are our targets that we're looking at. Most often they're going to be yellow and red because they need some help. And most often they're going to be things you're working on or your team members are working on, and you just want to keep them front and center. I can click on this and uncheck a little green flag and it disappears off of my login. Or I can pick as many of them as I want to put up there. This thing will scroll forever if you have a bunch of them you want to put up there. So this is the macro level or the dashboard screen. Again, the dashboard can be for the entire department. It can be for just your strategic plan. It can be for just tobacco, anything you want it to be. It gives you the ability to have that dashboard. Now, again, back in COVID time, we had a lot of extra time while you guys are out saving the world. And we put in a lot of features that folks were asking for. One of those we call VMSG Mobile. And what it is the ability to do a lot of these things on your phone. So not everybody in public health sits behind a computer screen all day. So in this case, we look and say, okay, I can go to the same exact link on my web browser on my phone that I did on my dashboard on my desktop. I got exactly the same login credentials, but it knows it's a phone. So it breaks it down across 3 phone screens here. So same exact screen you just saw, top left corner, bottom, top right corner, same functionality. I can click on anything. I can drill down. I can turn my priorities on and off, everything I want, but I can do it on my phone. So it just makes it real convenient if you're out and about in the world. So what we just went over is the core functionality. We call it a VMSG. Uh, as Andrew mentioned, we have about 240 departments across the nation using it, mostly focused around FAB accreditation. We have the whole state of North Carolina who has their own state accreditation process, so we manage that entire process across 87 health departments in there. But for those folks who are doing FAB accreditation, they typically start out with the FAB 6-packet plans in the system, and some of these are combined. Sometimes your QI plan is part of your strategic plan, things along that line, but they're all going to be in there. We have all of the accreditation and reaccreditation plans built in, which is basically a step-by-step process to go through reaccreditation. Well, you guys are at the end of this cycle, but you're going to be starting another 5-year cycle here, so we can map you right into that. And then the real-time planning. The real-time planning is collecting all the information in the background and kind of automating the 9.1.6 for you. Everybody who's done exactly what I just described has gotten fully demonstrated by FAB for performance management. So we know it works, and we'll help you to get through that process to make it very easy for you. Now, I'm going to talk about some of the other cool features that we've built in over time that are kind of outside the core functionality here, but really some nice features in here. But before that, I want to see if there's any questions. This is what Andrea made me put in, so I take a breath. You're muted.
I don't have any questions, but I sure like the functionality, and I appreciate you walking us through all those different pieces. Margaret, any questions?
Yes. When you were talking about the PDCA cycle,
Right.
and I was trying to take some notes, of course, while you were talking. What triggers that PDCA cycle? Is that based on the performance metrics that you set in there? Is it based on the color of the stoplight that you have, that is reflecting your performance? I mean, how is it? Do the staff themselves sort of set that expectation as like every 3 months I'm going to check in and do a PDCA? I mean, how is that?
Yeah, that's very flexible. Typically, what you're going to be doing is looking at your dashboard. So let's say I look at the dashboard for the strategic plan, and I start looking at it, and I notice we start getting some red lights creeping in there somewhere. So I want to be able to go in there and say, okay, I'm going to do the check phase right there. I've been collecting this information in the background, hence my dashboard is populated. I'm going to go in and check and find out what's going on. At that point in time, then I say, oh, I see, we overestimated on this particular metric. We're going to have to reduce the metric, or we don't have enough resources to get to the metric. So it's typically kind of triggered by the dashboard screen. So my dashboard is what's going to guide me into going into through the rest of the PDCA cycle, if that makes sense.
Yes. Hang on. And then my next question is, based on what were you including as the most popular accreditation plans?
I'm going to get
I
into
know it was
it
the
later.
CHA, the CHIP, the workforce plan, the department strategic plan. So those are like 4 of them that I could just name, like right off the top of my head.
So the strategic plan, the CHA, the CHIP, emergency operations, QI, and workforce development are the 6 plans.
Perfect. Thank you.
Mhm.
I just, trying to read the screen. It was just like, oh, okay.
Little tiny in there.
So tiny.
Yeah. I'd be happy to send you a copy of the slide so you have all that information if you'd like.
Yeah. And then you said that you're in 240 health departments across the country, including sort of the entire state of North Carolina.
Correct. Yeah, North Carolina, through the University of North Carolina, has their own state accreditation plan. So all of the 87 health departments
I see.
are accredited that way. So
Got it.
We provide the system. All the health departments use it to do the full accreditation process.
Got it. Thank you.
Anything else?
No, I think that really covers just kind of looking back through my notes. Yeah, I think that really covers my questions. Thank you.
Okay. Well, let me take you through some of the cool toys that we've developed over time here. So document management is built in. As you well know, I don't know how many documents you guys have submitted, but the words I hear, somewhere between 300 and 1,000 documents get submitted up into the EFAB system for accreditation. Sometimes you may have a way, obviously you guys already have a way to manage those, but we built that right into the system. So there's an accreditation plan built into the system, which I'll show you here in a minute. And what you're doing down at the measure level where the documents are typically designated is you attach the actual documents that you're going to be using in here as you're going through the next 5 years, let's say, for reaccreditation again. You attach all those documents in there. You know where they are. You know what measures they belong to. You pull them out of here. You shove them up into EFAB, and you're all set to go. About 6 months ago, one of our health departments in Michigan came to us and says, we got a problem we think you can help us solve. We have a bunch of critical documents. So we have standard operating procedures. We have memos of understanding. We have policies. We have grant documents. We have FAB documents. Every one of them has got a life cycle. Every one of them has to be updated in that life cycle. Typically, it's a fiscal year, but it could be pretty much anything like 5-year life cycles. We know who's supposed to be doing the updates on them. What we don't have is something to track that and to make it happen. So, for instance, you might say that, hey, Fred, you need to update this SOP by the end of September. So we built that functionality right into the system around the document management. And what it allows you to do is say, okay, Fred, you're assigned to this particular standard operating procedure. The document is attached to the activity. The activity is set for an annual timeline from, I don't know if you guys' fiscal year is July 1 through June 30th, whatever it is. You're going to set the timeline in there. You're going to say 80% of the way through that year, about 9.5 months or whatever you want it to be, Fred is going to get notified that it's time to update that document. The document is right there in front of him. It's in the document management. You download the document. You do the updates to it. You upload the new version. It does automatic version control. The lights all reset to green, and you go off for the next year. So what it does is help you to manage every document in the department if you want to. And as a side benefit, you're typically going to set up a group called document management or whatever you want to call it. Everybody can have read-only access to all those documents so they can actually use them for what they're meant to be done. So if you have a health and wellness standard operating procedure, everybody can grab that. They can look at it. They can use it. They can't edit it. They can't change it. They can't delete it, but they can take a look at it and use it. So it really, and by the way, this has become the most popular feature once we rolled it out about 6 months ago, because it seems like everybody has the same issue of managing critical documents. So it's all built in. And by the way, we don't limit the type of documents, size of documents, number of documents, anything like that. We just don't believe in it. Document storage is really cheap, so we just kind of keep it in there as much as you want to have in there. This is kind of an example of what that might look like in here. So you build a group called, your administrative services. You have a service under there called Department Policy Review and Revision. The goal is to manage and update all administrative policies. The objective, review and revise the administrative policies as required. And then you get down to that activity level. We call it timeline activity. Review and revise the 24/7 coverage policy number 0802 annually. The document's attached, and it just goes through the life cycle I was just telling you about. And you can replicate this as much as you want and have as many documents as you want to have it. But really is just a very clean way to manage those documents here. Now, next thing I want to talk about is three-dimensional planning. So one of the things that it's nice to be able to do is to map your plans against one another. So for instance, your strategic plan typically gets mapped against all the other plans in the system. We talked about the bottom of the dashboard in here. So here's some examples where you might want to do that. So how are we doing against the 10 essentials of public health? So what you're going to do basically is map across all of the different plans in the system, and not just this, the six-pack of plans here, but every plan. So you've got an emergency operations plan, you got a community health plan, you got a FAB plan, got a FEP plan, everything in there. You can map against that. So ideally, you're going to say, hey, across all 10 essentials, we're doing a great job. Or, we're not doing so good on essential number 6, something like that. It's just kind of a mapping process. This is one that is really cool. Now, you guys are going to be going through, I'm assuming it's going to be a virtual site visit for reaccreditation. I think they're still doing that. But what you can do is go in using the FAB standards and measures and map all of that against everything in the system. So you can have your 6-pack of plans in there, all your other plans. You're going to say, what are we doing across the whole department related to standard 6.1? So even in a virtual environment, if you're doing Zoom or whatever with site reviewers, you can bring this up on your screen. There's a report that'll show you everything we're doing for standard 6.1, and it'll give you every piece of every detail, including every document. So it makes their job really, really easy to diagnose what you've got in there. Your strategic priorities, as I mentioned, so your strategic plan gets mapped against everything else in the system, kind of how are we doing on all of our strategic priorities. And the same thing, you're going to have hundreds of documents in there potentially. You can map those against anything else in the system. So these are the 3 documents we'd be submitting for standard 4.2. So basically it's a categorization process, a very simple point and click. And it's kind of the last thing we go into in the training, because you're going to use your own plans to learn how to map all these plans together in there. But really, it's a pretty cool tool. The real-time planning we talked about. This is kind of, again, I call it automating 9.1.6. Here's how it works. Most people set this for a monthly cycle. You can set it for anywhere you want. Let's say it's set for the first Monday of the month. So first Monday of the month at 1 a.m., the system goes in and looks at everybody that you designated as an objective lead or an activity lead. And then it asks 3 questions. Question number 1 is, has this person been in the last 30 days and updated their stuff? Question number 2 is, does this person have anything that has fallen behind schedule? And number 3 is, does this person have anything that's overdue past the ending date? If none of those are true, no emails. If any of them are true, out go the emails. As I mentioned, the emails can go to internal folks as well as external partners. Now, the only people who get these emails are those people who are designated as objective or activity leads. So when they go back in, they're going to get an option to go into what we call quick update. Quick update is real simple. It's 2 screens. Each screen has 3 fields to update: traffic light, data value, notes. And then it's got the next button. You go to the next one, you're going to go through all your activities, you're going to go through all your objectives, you're going to log out. Timeline typically is about 3 to 5 minutes per person per month. So you get it down to, as I mentioned earlier, get it down to the people actually doing the activities and managing the objectives, so they know the answer already. So it makes it real simple for them. And again, 5 minutes later, they're done for the month. The quick update screen looks like this. The top of it is the top of the pyramid. So the group, service initiative, goal, objective says I got 29 activities I'm going to be updated. A lot of demo data in here. But again, the only thing I'm going to update is the traffic light, the data value. I'll put a note in if I need to. I've got access to that data source page down here. Then I hit my next button. I'm going to go through all my activities. There's a similar screen for objectives. I go through those and I'm done for the month. So it's just kind of a nice, simple way for everybody to make sure that they're keeping all of their stuff up to date, so you can use that to manage the business here. Now, it's another thing you can do on your phone. So here's my example. I'm driving into the office in the morning, decide to go by Starbucks and have a coffee, go in there, grab my coffee, sit down at the table, pop open my phone. It's the first Monday of the month. Oh man, I got this email from VMSG. I might as well get it done while I'm here. Click on the link, log in, go to my activities, quick update, update those, go to my objectives, quick update, update those, log out, I'm done for the month. So it's just a nice convenience feature to have. Obviously, everything you're going to do is going to require reporting. We have every kind of report known to man built into the system. We're going to go into a lot of detail in the performance monitoring training about how to use the reports, and there's bunches of flexibility in the reports as well. But the most common report is this top one called an operational plan. It's very, very detailed. And it might look like this for the tobacco program. So you can see the group up here, tobacco, the initiative, tobacco cessation. Anytime there's a document attached, it shows up in green as to, like, this is attached to the initiative. That data source we talked about shows up down here as red. And then you've got all the objectives, activities, the people, the traffic light status, the current status of the objective and activity, everything you want to know but we're afraid to ask. Typically, the only person who wants this level of detail is Steve Hansen. He's the guy leading the charge here, so he wants to know what's going on. Other people might just want to know, hey, how are we doing? So we created VMSG Public. VMSG Public is just a simple way to create public-facing web pages around any data elements in the system here. So in this particular case, we have the tobacco cessation program up here. So this is the initiative. When I roll my mouse over, you can see the number of gold, green, yellow, and red, and it says we're 51 days behind schedule. So it's just a graphical snapshot of the performance. And then I'm breaking it down to the goal of reduce smoking in high schools, same kind of thing. I can get down to the objectives of Wayne High School, Desert Vista High School, and I can get all the way down to the activity level if I want to. So I can show the rollovers of the current status of the number of training sessions we provided, that sort of thing. Literally, once you do this one time, it takes you 5 minutes to create one of these. Whoa, hang on a second. My computer just went blank here. Hold on.
Yes.
Oh my goodness.
Hold on a second.
Oh,
Hang on.
I'm so proud of myself. Yeah, something happened for sure. So I will tap dance until he gets back. You know,
Okay.
it's funny. I've never recalled so many problems as in since the heat. Now, granted, this is coming from our local Wi-Fi. This isn't the server. And since the heat, you know, it perked up the past couple of days, it's like 118. It is the most bizarre thing. And I have had a hard time on all my presentations.